Being diagnosed with rectal cancer can be scary. There are lots of questions and concerns when you hear the words, "you have rectal cancer." The American Society of Colon and Rectal Surgeons has put together this video to answer questions and concerns for you and your family about having rectal cancer. Cancer of the rectum is cancer of the lowest portion of the large intestines or colon. Many people may not have any symptoms when they are diagnosed with rectal cancer and may find a rectal cancer on colonoscopy. Other people may experience change in bowel movements, bleeding, or think that they have benign diseases like hemorrhoids prior to being diagnosed with rectal cancer. Although some people may have a family history of rectal cancer or colon cancer, about 3/4 of people have no family history and no known risk factors for having rectal or colon cancer. A rectal cancer is generally diagnosed on colonoscopy. A colonoscopy goes all the way through the colon to where the small and large intestines meet. During the colonoscopy, the endoscopist or person performing the colonoscopy may take a small piece of the tumor for diagnosis. This is sent to pathology. The most common type of rectal cancer is adenocarcinoma, or cancer coming from the lining of the intestines. Once a diagnosis has been made of rectal cancer, it's important to determine how large the tumor may be and whether or not it has spread to other parts of your body. This process is called staging. Staging is very important because it determines what should come next in your treatment of rectal cancer. During staging, your doctor may recommend additional testing such as a CAT scan or CT scan. This helps to determine whether the tumor has spread to any other portions of your body and will include a CT scan of the chest, abdomen, and pelvis. In addition, for rectal cancer, it's very important to determine whether the tumor has spread locally. Your doctor may recommend additional testing, such as an MRI or ultrasound, to help determine whether the tumor has spread to other organs in the pelvis or to the lymph nodes. Other parts of staging include completion of a colonoscopy and a blood test called CEA, or carcinoembryonic antigen. Once your tumor has been staged, the next step is to be presented at a multidisciplinary tumor board. Because the care of rectal cancer is very specialized, expert recommendations include presentation of your situation at a multidisciplinary tumor board. The tumor board consists of rectal cancer surgeons, oncologists, and radiation oncologists, as well as radiologists and pathologists who will help determine the best possible treatment for your cancer. Together, this group will review all of your information, the staging, radiology, and pathology available, and help determine what the next best steps may be for treating your rectal cancer. It is recommended that all cases of rectal cancer be presented to a tumor board prior to starting treatment. Depending on your cancer, your doctors may make a number of different recommendations for treatment. They may include surgery, chemotherapy, and radiation therapy. The recommendations will depend on how far advanced your cancer is at the time of diagnosis. Early cancers may be treated with surgery alone. This type of surgery may be done through the bonum or anus and is reserved for very early rectal cancers. As with all surgeries, the risks and benefits of this procedure should be discussed with your rectal cancer expert. In many cases, cancer of the rectum may require surgery through the abdomen. For some patients, the surgery may be done using minimally invasive techniques such as laparoscopy or robotic surgery. The details of your case should be discussed with your rectal cancer surgeon and depend on how advanced your rectal cancer is. Removing the cancer in one piece is very important to decrease the risk that your cancer will come back again. Prior to your surgery, your multidisciplinary team may recommend that you have radiation or chemotherapy. If you need radiation and chemotherapy, the reason for this is to help reduce the size of your cancer and make it easier to remove this all at once. In general, chemotherapy and radiation will take 2 to 3 months to complete. Following this, you'll return to your surgeon in order to evaluate the tumor and see whether it is decreased in size. If you need radiation therapy, you'll be referred to specialists, including an oncologist or doctor who specializes in chemotherapy, as well as a radiation oncologist. They will talk to you about the specific risks of this treatment. Before you start chemotherapy or radiation, it's very important to see a rectal cancer surgeon. When you see your rectal cancer surgeon, they will want to evaluate the tumor by doing a rectal exam. They may also want to do an evaluation with a small scope through the anus. This helps to determine how far the cancer is from the anus and whether or not you will need a bag or stoma following surgery. Being evaluated by a rectal cancer surgeon is important before you get the chemotherapy and radiation and before the tumor starts to shrink. By seeing your rectal cancer surgeon prior to surgery, they will help to evaluate what your response is to the chemotherapy and radiation. In some cases, if the cancer is spread away from the rectum, the multidisciplinary tumor board may recommend chemotherapy rather than surgery. It is very important that your doctors discuss what your treatment options are and why they've made those recommendations prior to starting treatment. After treatment, it'll be important that you're watched closely over the next several years. Evaluation may include additional testing such as CT scans, colonoscopies, and repeat blood testing or CEA levels over the next several years. Additionally, it's very important that you continue to follow up with your rectal cancer surgery specialist in order to make sure that there's no sign of the tumor coming back.